Specialists recommend that one should avoid continual exposure to music amplified to more than 104 to 111 decibels. It is believed that the loss of hearing associated with aging may not be a result of growing old, but rather a lasting effect of living in an increasingly noisy environment. A warm welcome to the Alice Makaya Show. Today we have our resident Dr. Vivek Solanki and Dr. Jenny Nesgard-Pedersen, an audiologist in a private practice, to discuss about hearing disorders. Well, it's always a pleasure to have you, Dr. Solanki, and of course our guest, Dr. Jenny. So what causes hearing disorders?
There are many reasons for hearing disorders. One is that you are born with it, it's hereditary. Other is physical, where it's due to trauma, infection, or chronic exposure to loud sounds, nightclubs, headphones, things like that. Also with aging, people, the older they get hearing disorders as well.
And Dr. Jenny, how do we hear sound?
Well, it's physical vibrations that the system is able to pick up. So you'll have these physical vibrations that enter your ear canal and actually move your eardrum, which then in turn moves the middle ear ossicles, and that is then translated into sound waves that travel through the water that's contained inside your auditory system in the inner ear.
So having said that, what are the different types of hearing loss?
Well, we usually categorize them as either being conductive, sensory neural, or mixed, so a combination of the two.
And why is it that with age you tend to lose your hearing, especially if you're well into your 60s?
Well, firstly, I think you are exposed to various noises in any case. And also with age, your fine hearing hairs that are in our middle ear gets affected, they degenerate naturally, and they get fewer and fewer.
Mm-hmm. And is it true that heavy doses of quinine and aspirin can actually cause a hearing loss?
They're not the only ototoxic drugs. There's also cancer treatment, TB treatment. Because the hair cells are so fine, they're very sensitive to any external drugs or poison coming in, and they're the first ones that will actually give up on functioning. So hearing
and in fact, common drugs like aspirin, quinine, these are things we use almost every day for treating malaria or headaches and things like that can cause hearing disorders as well, and especially tinnitus.
Yes, especially
where you
that's
find
the
the
first
patient
thing.
complains as the drip is running, says, "Oh, doc, my hearing is going, I can hear already."
All right. And what about brain infections such as meningitis? Can those cause hearing loss?
Yes, because everything is so closely packed inside our skull. So an infection of the brain will also be infecting the auditory nerve, visual nerves, and that can cause a...
Yes, because it's a lining of the brain, isn't it? That's meningitis. That's meningitis. The meninges of the brain are infected. And that's what protecting your hearing auditory nerves. And they get infected, and that's called calcification. It goes into the canals and the crystals. And so, of course, sound cannot travel as well anymore.
Mm-hmm. Right, that's really interesting. So if you have a lot of wax in your ear, can that affect your hearing?
We can certainly give you a temporary hearing loss because you have blockage in there, so the sound isn't traveling in the way that it should be. And if left long enough, it can get impacted, which means then you're now at risk for infections in there, and any new wax that's being introduced into the system is adding onto this impacted mass that you have in there, making the hearing loss bigger and bigger.
Right, so let's just take a look at the structure of the ear. Can you just tell us how the ear is structured?
Sure. So usually we divide it into three portions. So there's the part that you can access from the outside, which would include what's visible and your ear canal, up to the tympanic membrane or the eardrum. That would be labeled the outer ear. Then on the other side of the tympanic membrane you have the middle ear ossicles, and that would be the middle ear. And then the cochlear and the semicircular canals, that's then the inner ear. So those are the three parts of the ear.
So which one is most likely or susceptible to, infection?
Well, all of them are, but different types of infection. So for your middle ear effusions that your children get, the name says it, that's in the middle ear. So that fills up with fluid and gives them a temporary hearing loss as long as the infection is ongoing. Whereas meningitis, that would be the inner ear because it has closer proximity to the cochlea. So it depends what the type of infection is, but all the areas are susceptible.
Right. So who is likely to get an ear infection?
People that swim, babies, young children that get ear infections, throat infections, they are linked through the suction tube. Babies that get meningitis. Of course, then the adults who have infection through trauma, whether it's through physical trauma of a gunshot or a slap, or a car accident or something like that. So these are the various groups of people that are exposed to
Yeah.
infections.
Even people who use earbuds.
Yes,
Yeah.
absolutely.
An everyday thing that's not meant to go in your ear but that we put in our ear can actually scratch the skin and cause an infection.
Jeez,
We
so
always say, do
amazing.
not use earbuds.
Right.
Nothing smaller than your elbow should go into your ear.
Amazing.
Yes,
So
yes.
nothing at all.
No.
So how do
absolutely
you clean out your ears if you have wax?
If you have wax. Well, if it's impacted, you'll need to see a specialist. But generally speaking, the ear is a perfectly functioning ecosystem. It cleans itself out. The skin renews and it pulls out any debris with it. So if you leave it, it'll do its thing and it'll function perfectly. But once we start to now mess with that balance by using earbuds and causing scratches and things in there, then we may need to seek the help of a professional to get the wax
In
out.
fact, with
Right.
the use of earbuds, you're actually pushing the wax back in deeper and deeper, and then it gets impacted on itself. It can become hard as a rock.
Jeez, and
Yes.
obviously,
So-
I suppose it would, exert pressure on the eardrum.
Absolutely.
And what would be the impact?
Well, infection, as we're talking about, could be, and then also the hearing loss that's caused because you have something blocking out your ear canal and sound can't travel in. And then anytime you introduce something else, you have an impacted mass in there, and you're not pushing an earbud, a cotton bud, and you may even end up rupturing your tympanic membrane, making a hole in your eardrum, basically with the wax. So you're making issues for yourself that wouldn't have been there if you
Yeah,
just
that
hadn't
wouldn't
put
be there.
something into your ear.
Okay,
Yeah.
so the thing is never to put anything inside your ear. I've heard, or there are people out there, who put cooking oil or baby oil in their ears to soften the wax so that it comes out. Is that advisable?
I'd say if we advise anything, well, we advise you not to do anything if you don't have, issues and it hasn't been prescribed. But if you are going to put something, almond oil is the one to do
Why almond oil?
because it has
It's
antibacterial.
anti-inflammatory.
Yeah,
It's also an antibacterial.
antibacterial properties. Yeah.
So if it's warmed slightly and put into the ear canal, it can melt the wax and remove the extra wax from the ears. However, our suggestion is usually let the mothers who are experienced in it deal with it, or grandmothers, or go to your doctor, GP, or a specialist, ear specialist, to help you with such a thing,
Yeah.
to avoid any damage.
And can you tell us about some of the ear infections that one can get?
Well, you can get anything in there. You can actually get fungal type infections as well. So when we look at it, it looks like, moss growing inside your ear. And usually that would come if you've had a treatment with antibiotics, puts your body out of balance, and then the fungus actually takes over. You can also have a weepy ear where you actually have discharge coming out. It can be clear in color, it can be yellow, it can be bloody, depending what stage you are with the infection. And that would usually be a sign that the eardrum is actually ruptured, because the fluid builds up behind the eardrum, gets too much, and it actually ruptures the eardrum, and you get this weepy ear.
So that's common in children, who have middle ear infections.
Yeah.
Then you find the mothers come and they say, oh, my child's got a weepy ear, what we call a weepy ear. And that's actually the eardrum is ruptured, and now the pus is coming through.
And on
Yes.
that note, we take a break. Stay tuned for more.
As we grow up as children or babies, what we're hearing, we mimic, our brain mimics that and produces it as speech.
Welcome back and thank you for staying with us. I'm still talking to our resident Dr. Vivek Solanki and Dr. Jenny Nesgat Patterson, an audiologist in private practice, and we are talking about hearing disorders. Just before we went on the break, we were talking about the eardrum rupturing. What can cause the eardrum to rupture?
Well, anything that will change the pressure drastically. So if you are experiencing an explosion, that could rupture it right away. Or it could be a build-up of pressure because of liquid behind the eardrum. That can also make it rupture because the pure pressure just needs to go out somehow. That will go through the eardrum, or it can be trauma as well.
Right.
So it can be gunshot, explosion, firecrackers, middle ear infection, children having pus build up in the middle ear and eventually it ruptures. That's all the cause of the ruptured eardrums.
Right, but once it has ruptured, can it be restored?
Yes,
It
yes,
can.
yes, absolutely. I mean, it can heal on its own, or one has to go and physically operate on it and fix it. I mean, it's a very thin membrane, you know. It's so it's easy to rupture, but I think it's also possible to fix it quite
It is, yeah.
reasonably.
Right.
In most cases, if it's once or twice in a lifetime it's happened, usually it'll heal by itself. But if you have recurring ruptures, if you have recurring middle ear infections that you're not dealing with, and pressure is building up and it's rupturing repeatedly, at some point it'll give up. But once or twice, it should be able to fix itself.
But once it's ruptured, do you actually have a permanent hearing loss?
You would have deficiency in your hearing, absolutely. I mean, the sound will not be as pure as the one with the complete eardrum.
Right, and how long would it take to heal?
It varies. It varies. Anything from a month to 6 months. If you don't
That's
see it
long.
healed after 6 months, then it's probably not going to do it on its own. And even when it does heal over, there will be scar tissue. So that scar tissue will inhibit the movement of the eardrum somewhat. So you may get a small conductive element.
So what is the connection between speech and hearing?
Speech and hearing, as we grow up as children or babies, newborns, what we're hearing, we mimic, our brain mimics that and produces it as speech. Now that can be through sound or noises, or it can be through vibrations as well. These are the two areas how we perceive sound and how the brain interprets.
So if you've never heard speech, most likely you won't be able to produce speech. And this is why usually when you talk to someone who is very hearing impaired, who has profound impairment, you'll hear that they have deaf speech. Because some of those consonant sounds, some of those high frequency sounds, they've never heard, so they don't know how to produce them. So you can actually, from their speech, hear that they have a hearing problem.
Right.
Yeah.
Okay, so if you're dumb, you'll definitely be deaf. And if you're deaf, then you'll be dumb as well. Is that right?
I think that's maybe a categorization we moved away from, but yeah, in effect, yes.
Okay, so how does one communicate with a deaf person?
So it's very important that you're actually visible, that they can see your face, because they will make use of your facial expressions as well as your lip movement for lip reading. So we do that anyway if we're here normally, but when you have a hearing impairment, you become even more reliant on those extra cues to make sense of what's being said to you.
Mm-hmm.
So don't shout at the deaf
No.
person, because your facial expression will change and they will not be able to understand what you're trying to say.
You actually
They may-
distort it. Yeah.
Yes, and they may even misunderstand you.
Think you're angry. Yeah.
Okay, so it's important also to speak normally.
Speak
So
normally,
that your
don't
speech
shout
is
at
not
them. Yeah.
distorted.
Exactly.
Okay, so what is the rehabilitation of the hearing impaired?
Well, there's a variety of things in addition to hearing aids, which we'll talk about later. There's things to make their environment more conducive to their hearing loss. So having doorbells, as we're talking about, that flash as opposed to ringing, having visible that the phone's ringing as opposed to a sound. Some people also have alarm clocks where the whole bed vibrates because they can't hear the alarm going off, so they need that
Really?
physical vibration
That's
for
an
them to
interesting
get up
one, hey?
in the morning.
Like a
Yeah.
slight
Is
massage.
is it an earthquake or do I just need to get up? Yeah.
Okay, right. And can you tell us, Dr. Vicky, about the Occupational Health Act?
Yes. In Zimbabwe now, for a few years, we've got the establishment of the Occupational Health Act, and in particular for noisy environments and people working in the noisy environments. So now the law compels employers actually to send the employees for pre-employment hearing tests, and during the employment they have annual hearing tests as well, and after they leave the employment they have the final sign-off, so to speak, of the hearing tests. The importance of this is because a lot of the people work in noisy environments, factories, mines, the aerodrome, trains, bus drivers, truck drivers. I mean, you look at any environment where it's more than 85 decibels every day constantly affecting you is going to diminish your hearing and cause hearing loss on the long-term basis. So I think it is important that we assess regularly and try to prevent future hearing loss on these patients, because it does cost him, it does cost the company, it has an impact on his environment, on his family, on his ability to earn an income. So I think one has to be more cautious and follow the rules.
Right, but is that act being applied in Zimbabwe?
It has been applied to a certain extent. I suppose at the moment the bigger companies do, the mining companies do it. I know the aviation industry does it, and a few others apply to it. But I think we're hoping that through encouragement and awareness, that more and more people are aware that there is an act in place and that they should do something positive about it.
Right, and while we're on that subject, in aviation it's very important for the cabin crew to be medically fit, especially, particularly when it comes to their hearing ability.
Yes.
Can you just tell us why?
Yes, again, the cabin crew, pilots, anybody working the aircraft technicians, they're exposed to chronic loud noise. The engine noise of the aircraft is huge. And so one has to monitor that and prevent hearing loss. Now, can you imagine if a cabin crew has a hearing problem? They've got a middle ear infection or they've got a ruptured eardrum or something like that. The pressure differences when you're taking off, when the pressure is actually decreasing, it can rupture your eardrum. It can cause severe pain. It can disable them. So they will not be able to actually assist the passengers. In fact, the passenger might have to come to the assistance of the cabin crew and help them and resuscitate them.
And they are the emergency staff, right? In an emergency.
Absolutely.
So if you're not able to communicate because you can't hear, that'll be a dangerous situation
real
in the air.
Yes, absolutely. So now wearing devices such as headphones can obviously prevent you from, getting a hearing loss. So what are the dangers that are associated with headphones, earphones, as well as perhaps using cell phones?
Well, it's all to do with the level again. So anytime you're exposing yourself for a prolonged period of time, it doesn't even have to be that loud. But then if you now go with very loud levels, you can only maybe handle 5 minutes and you'll actually start doing damage. And what we're seeing is it's become very popular with these earphones that go in the ear. And they actually shut off the ear canal and make the volume of the ear canal very small, which means your system will perceive that sound on the same dial setting as much louder. So damage occurs much easier with those systems.
Yeah. Are there any specific headphones that one should wear if they're working in a very, a noisy environment?
Absolutely. They are called noise cancelling headphones. They're specific for industry. And they are different from the normal headphones, because I've seen in some industrial areas where people are just wearing normal headphones and they don't actually protect you from the external sounds. You need noise cancelling headphones.
Right.
That will protect
And what is the difference between headphones and earphones, and which one is more devastating to the ear?
It's got to do with the placement. So the headphones you'll actually have around your ear, placed on your head, whereas the earphones go into the ear canal. And in terms of noise exposure, the worst ones would be the earphones on the same note. In terms of cancelling out noise, when you actually plug up your ears instead of just wearing headphones, that's also more effective. So
just focusing on the loud noise. But not only that, now can you imagine a lot of cyclists, people jogging, they've got these earphones
all
in,
these earphones,
and they can't hear external noise, right? Car coming through, hooting at you. So not only ear trauma, you're going to have major trauma on you.
Serious trauma for
Get
real.
knocked down, but you have a road traffic accident.
Yeah, and what about cell phones?
Well, if you're just holding it up to your ear, that shouldn't cause any damage. But if you're then listening to sound from your cell phone through these earphones, then it's the same as with everything else. You will cause damage eventually.
And on that note, we take a break. And when we return, we'll be taking a look at the treatment of hearing loss. Stay tuned, we'll be right back.
There's several aspects of hearing, and so the tests are also varied. One test will look at how well we receive sound that's just coming in through the ear canal. Another will look at how we receive sound when it's vibrated through the bone. And another test will look at what the nerve function is.
Welcome back. You're still watching the Alice Makaya Show. And I'm still talking to Dr. Vivek Solanki and Dr. Jenny Nesgard Pedersen. And we're still on the subject of hearing disorders. And in this segment, we're going to be taking a look at the treatments for hearing loss. And Dr. Jenny, what is the test that's done to determine hearing loss?
So as we spoke about earlier, there's several aspects of hearing. And so the tests are also varied. One test will look at how well we receive sound that's just coming in through the ear canal. Another will look at how we receive sound when it's vibrated through the bone. And another test will look at what the nerve function is. So how is our speech understanding if the sound is loud enough? I usually describe it like an analog radio, that one dial is the volume and the other one is actually finding the station. So if your system is so, broken down that you're trying to catch a station that's 2 sounds over, no matter how loud it gets, it's never going to be 100% clear. And we need to figure that out through the testing and piece it together.
Can you tell us about the newborn hearing screening that's now available in Zimbabwe?
Certainly. We're very excited about that project. It's been running since February last year. And the objective of it is to catch babies at a very early stage, before the age of 6 months. So we do a screening of the baby's hearing by just playing some click sounds and measuring echoes, so they don't have to be able to press buttons or do anything like that. And that'll then catch 99.9% of babies with hearing deficiency from birth.
No, this is very important for Zimbabwe, actually, because in the past we were not able to do this. And that's how we got so many children and adults with hearing deficiencies who are deaf, and as a result dumb as well, and they have problems finding jobs and getting the profession going in any field. Now, picking up the kids early, from childhood, from birth, we can identify the problem and hopefully sort it out. Or prepare them for it and train them for it, have hearing aids inserted, or do implants, anything. It opens up a whole new world for them and minimizes the morbidity of having the hearing deficiencies.
Absolutely. So what about for the older ones? How soon should they seek medical assistance if they're having hearing problems?
Now, that's a difficult one, right? I mean, usually the wives bring the husbands in. This man is not listening to me.
He can't hear me.
As we age, the high-pitched sound frequency is what gets damaged, because the fine hairs that are in the middle ear canal and that inner ear erode away due to natural age and aging process. And of course, women and children have a high-pitched sound or noise or voices.
Naturally.
So those gentlemen, or those men, although they can hear other people normally, they can watch and listen to the TV normally, they don't hear their wives or they don't hear their children. Right? So the women think, oh, well, my husband's not listening to me. But it's actually true. He cannot hear the high-pitched sound. And that's because of age-related hearing disorder. Yeah.
And that's one of the main differences between age-related hearing loss and childhood hearing loss, because by the time you're in old age, obviously you have developed speech. And it sneaks up on you gradually, and it's now becoming more of a quality of life issue, whereas opposed to with children, if they can't hear, they can't develop speech, they can't go to normal schools, and in some ways it's kind of guaranteeing them poverty in adulthood because they can't do mainstream jobs, which makes life more difficult for them. So that's the main difference between the categories. But I think the statistics say for adults, from when they find out they have an issue until they actually seek help, 5 to 7 years, which is too long. If you're not using it, you're losing it. And if I don't do something today and I do something in 2 years, I won't be as good as if I'd done something today, because the brain stops using that part of the auditory system. Yeah.
So what is the treatment for hearing loss?
Well, it's multifactorial. Depending on the cause, right? Is it something that you're born with? Is it something that was traumatic? Is it a middle ear? Is it external ear? Is it the inner ear? Right? So the treatment then is either hearing aid to help you, to amplify, or combination of using bone conduction and hearing aids. There's also now we have the cochlear implants. We actually do the implants, and it's available in Zimbabwe as well, the specialists that are doing it here, or do the middle ear implants. So it depends on the type of hearing loss one has, and accordingly the hearing aids are available.
Right, so do we have all the, the different types of hearing aids? Do we have them available in Zimbabwe?
We do. Usually we categorize them as either being behind the ear or being in the ear. But then the model, the size, the shape will depend on the size of the hearing loss. We have some examples here of what it could look like. So this would be able to amplify moderate to severe type hearing loss. So you can see it's not as large as maybe what we're used to seeing on our grandparents 10, 15, 20 years ago. Cosmetics has become a big focus in the hearing aid industry, luckily for those that are a little bit vain, that you can now have your hearing amplified without anyone being able to see it.
Right.
Yeah.
Well, it's become a fashion statement as well. I mean, you find all these singing divas, musicians, who have some sort of hearing impairment because they're exposed to chronic loud noise and that, and they have these hearing aids, and it's become a fashion statement. They are so small, and they have in different fancy bright colors and diamond studded and all sorts of gold plated.
Right. So does it matter whether you have one that goes behind your ear and the one that goes inside your ear?
No, it doesn't matter. What you will find though is as the hearing loss grows, the size of the hearing aid will need to grow. So at some point you won't have enough space in your ear canal for the level of amplification that you need, in which case you would be it would be necessary to have something behind the ear. But what we're finding as well is I actually prefer to do the ones behind the ear, because all you would have in the ear is this little, for comfort, this little dome, that's all. Which I find is a lot more discreet, a lot more cosmetically appealing compared to having your ear filled out with plastic. And then also you have to think about that this is a piece of electronics, so you've got your wax, your sweats, whatever else, it's likely to break down more often if it's in the ear as opposed to sitting behind the ear.
Right, so how does the hearing aid work?
Well, it will have a microphone in the amplifier, in the processing part, which then adds on whatever level of amplification that you need. So that will be specific to the person's individual hearing loss. And then that amplified sound is then funneled into the ear. In this case, the loudspeaker is actually in the ear. In other cases, it can be in the processor and then it's just funneled through some tubing into the ear.
Right. Dr. Solanke, can one have a surgical operation to improve hearing?
Yes. Depending on the type of hearing loss you have, you can have cochlear implants, you can have middle ear implants, and these are now available in Zimbabwe.
Right, and which one would you say is the most effective?
It all depends on the type of hearing loss you have. So you do the cochlear implants. It's more common for the younger children who are born deaf. They get the cochlear implants earlier in life, as soon as possible or as soon as it's affordable. That child's life is going to improve tremendously.
So what is your general advice regarding hearing disorders?
I think one has to be aware of the presence of hearing disorders. One has to be more conducive towards providing training and screening for people with hearing disorders, create the education and provide the platforms for them to be screened and have the access to hearing aids, rehabilitation, and possibilities of operations on the hearing deficiencies as well.
And then early identification. And usually the mothers are the ones that know the best. So if your baby wasn't screened, but you feel like, they're not developing the way they should, they're not reacting to your voice, when you try to calm them, they only react to touch, then maybe there's something wrong, and mothers usually will know. Get it checked out as soon as possible.
Your last take on the subject?
As I said, early identification, and if you don't use it, you will lose it, so have it checked out as soon as possible.
And Dr. Viveke?
Early screening, early identification, assistance from your neighbors, your family, those people that you know have a hearing problem, make them aware that help is available. And early help is early cure.
So if you don't use it, you will soon lose it. And the sooner you go for early detection, the better you'll be able to improve your hearing. And if you do have any questions to ask, feel free to contact us on the telephone numbers on the screen, and you can also email us. And if you've missed the show, be sure to check it out on YouTube. And on that note, we've come to the end of the Alice Makaya Show. And I'd like to take this opportunity to thank you, Dr. Vivek Solanke, who is our resident doctor on the Alice Makaya Show. And also to thank our guest who was here today to talk about hearing disorders. And that is Dr. Jenny Nesgat Pedersen, who is an audiologist in private practice. And do join us next week at the same time. Goodbye.